So we know that BRAF V600E mutations in lung cancer occurs in approximately 1%, 1 to 3% of cases, so it's a rare subset of patients with non-small cell lung cancer. These patients, differently from other oncogene-driven non-small cell lung cancer population, are often smokers, and they have often higher PD-L1 expression levels, and they tend to benefit from immunotherapy. So the aim of these studies was to compare immunotherapy with or without chemotherapy with BRAF and MEK inhibitors for the first-line treatment for patients with metastatic non-small cell lung cancer harboring BRAF V600E mutations. This study enrolled 284 patients in total across 17 centers in the United States, Europe, and Brazil. Two-thirds of these patients were treated in first line with BRAF and MEK inhibitors, and one-third were treated with immunotherapy plus or minus chemotherapy. The baseline characteristics of these patients reflect the physician's choice of the treatment, because patients who started with immunotherapy tended to be more likely smokers and with higher PD-L1 expression levels. No other differences were observed in baseline clinical characteristics between the two groups. And looking at the outcomes of these patients, according to the first-line treatment received, we observed that the objective response rate was significantly higher with first-line targeted therapy, which could be either the BRAF inhibitor trametinib or encorafenib berimetinib. Objective response rate was 63% versus about 48% with immunotherapy. But the median progression-free survival was similar between the two groups, was 10 months with immunotherapy and 12 months with targeted treatments, and the overall survival was significantly longer in patients who received first-line immunotherapy plus or minus chemotherapy compared to those receiving BRAF and MEK inhibitors. Was about 40 months with immunotherapy and 25 months with the targeted treatment.